Dr. BRC. I am in the field of what we can call as medical engineering. Medical engineering means putting engineering into medicine. I did my graduation in engineering, post-graduation in diabetes, and 2 honorary PhD, one in diabetes and one in chronic kidney disease. And presently I am running 20 hospitals in India. Next slide. 20 hospitals in India, and here for all kind of patients who come to us, we don't use medicine, we use medical engineering. And as you have been, this is a glimpse of my hospital, and Dr. Narjeet sitting here, Dr. Fernando also around. They already have visited last month only, and these are the hospitals all across the country. If you go to my hospital, you will not find medicine, drugs, but something else. And we specialize in reversing diabetes type 1. So when I say type 1, so it is very hard to digest that can type 1 be reversed? Can the children of type 1 lead their life without medicine? And that's what is about my presentation. There are two kinds of disease I'll talk about. One is type 1 diabetes and second is chronic kidney disease. The people who are dependent on dialysis, is it possible to bring them out of that dependency and make them healthy as they were before? So that is what I'm trying to explain. And my first innovation, which we did about 12 years back, that is through this book, Last Days of Diabetes, that what we call as DIP diet, a kind of diet which we give to our patients, and then we see by third day the blood sugar starts reducing, the blood pressure starts reducing by 7th day, and by 10th day their weight start coming down, their energy start going up. So the DIP diet is very simple. Normally one can Google and find it out, but I will take just 1 minute to make you understand this. In DIP diet, the very interesting, till 12 noon you have to be only on fruits, any 3 to 4 kind of fruit, and important is the calculation which you can see on the screen. It depends on the body weight. For example, my body weight is 70 kg, so I'll make into 10, that becomes 700, and now I'll make it, instead of kg, I'll make it gram. This means if I am on DIP diet, at least 700 grams of fruits I have to finish before 12 noon. That is the first job, first step. Second step is for lunch and dinner, always have 2 plates. Plate 2 is your favorite plate, conventional plate, what you normally eat. That is roti, sabji, dal, chawal, whatever you have been eating, your traditional diet. But plate 1, before you touch the plate 2, plate 1 is the vegetable, 3 to 4 kind of vegetable which you think that you can eat in raw, tomato, cucumber, radish, carrot, etc. And here also the most important thing is the calculation. Your body weight into 5 this time. My body weight into 5, that becomes 350, but I will make it gram. This means I have to eat about 350 grams of raw vegetables, and then only I am allowed to eat plate 2, which is the normal cooked food. This is lunch and dinner. The final step is avoid anything which comes out of animal, avoid anything which comes out of factory. And yes, you can include some kind of sprouts, nuts, and everyday sunshine. If not 40 minutes, let it be only 14 minutes or 15 minutes. So the moment you start doing it, what we have seen consistently over the last 1 decade, within the first 3 days the blood sugar starts dropping. Within the first 3 days to 7 days the blood pressure starts dropping. This means the people, they are forced to taper down the insulin, forced to stop the medications. So this we have been seeing, and lately in 2018 a randomized control trial was done by Government of India itself on what I have been saying, and these are the links of the randomized control trial done by Ministry of Ayush, Government of India. And although this randomized control trial was on bone disease, the effect of DIP diet on bone disease, and they realized that if the bone disease patients are put on DIP diet, so they get relief within 2 months. And here my friend Dr. Aziz, one of the well-known doctor of Malaysia. Dr. Aziz, are you there? Sir, please. Dr. Aziz has done a trial, observation study of DIP diet and on chronic kidney disease patient, and with the, under Lincoln University College, and here he added cupping therapy also, and within less than a month time, that is 25 days, the chronic kidney disease patients GFR, it increased substantially. So this is the letter which says all this. And interestingly, recently even government of Nepal Health Ministry, they did a trial on DIP diet, and but this time the trial was on diabetes patients, and they found that within 7 days most of them could get rid of the medication, and they were able to maintain the same blood sugar which they had been maintaining, but with the help of medication. So this means there are two randomized controlled trial and one observation study by Dr. Aziz, which has proven that DIP diet can be effective in bone disease, in chronic kidney disease, in diabetes, in blood pressure, and in obesity, of course. So these are the evidences which you can see. So this we have been doing for last more than 1 decade, and then came the COVID. Right here in India, in Malaysia, I've been frequenting almost every 2-3 months before COVID, and we have been organizing camps, 72-hour camp we call it, and there the patient, they used to be on this diet, and by 3rd day before they leave, they were able to leave the medicine itself. So, but now the COVID came. That was something interesting, when most of us or all of us were confined to their home. That time, I got an opportunity in India. We opened COVID centers. I opened COVID centers, and my COVID center was of 1100 bed. That is the biggest private COVID center in India. And this you can see the video. Sorry, the video. Play the video. So here you see my COVID center. And here also, unlike any other COVID center of the world, you see there is no social distancing, there is no mask, there was no sanitizer, there was no oxygen cylinder, and the interesting part is there was no death also. This was 2020, right? And this is my COVID center, as you can see. And in white t-shirt, you see these are my experts. We call them NICE expert, Network Influenza Care Experts. And these are all so-called COVID positive children. And here the first rule was, when any patient enter our camp, first the doctor has to hug the patient, right? And forgetting about the social distancing, and the next they have to eat together, right? We believe that mask and isolation kills, love and compassion heals. That was the philosophy, as you can see. So in total, we cured about 60,000 patients, those who got registered with us, 60,000 patients with zero mortality. And after that, an observation study was done by Ministry of Ayush, Government of India, and the observation study on our COVID center done by the Government of India, they accepted that within a week's time, most of the patients, they could be successfully cured without any medication whatsoever. And even during their stay, they were allowed to meet their family member. This means no social distancing was followed at all, and also they wrote that there was no adverse reaction, no untoward incident, no death happened, and finally they concluded in future for severe COVID patient also these protocol can be given. And the protocol was very simple. Any patient whatsoever situation they come to us, we put them on coconut water and citrus fruit juice. Coconut water and citrus fruit juice. And interestingly, nearby area, people used to donate a lot of coconut water and a lot of citrus fruits and some juicers also, and that's what we started giving. And only few patients, those who were having the low SpO2, that is breathing problem. So, and we were not having any ventilator. We were against ventilator because our understanding is ventilator only kills, right? Nobody can come out of the ventilator and live alive for more than 1 or 2 months. So we had an alternate of ventilator, which I will demonstrate here to you. So you see, my patient, when they come to us, mostly because our center was free. So when the patient admitted in any other private hospital, and when the doctor says that now they have to put on ventilator and the patient is poor, patient was poor, they don't had money, so they were now thrown or taken to our hospital, our camp, and our camp was free of cost, so anybody is allowed and everybody was welcome. So when the protocol is, when we accept the patient with oxygen cylinder with low SpO2, then we do this protocol which I am going to demonstrate right now. So you see, the protocol is very simple. Now, you all are sitting like this, watching me. Now, if you plan to sit like this towards the back, as you can see my posture, if you do it right now, you will understand, you will experience breathlessness. Right? The moment you lean towards the back, your heart is on your lung, right? The capacity of the lung keeps on decreasing, and that means your breathlessness increases, right? Right now, at this moment, if you try lying like this, you will find it difficult to breathe. So you see, whenever you see a patient who are in a breathlessness situation, it is, you will see coincidentally, they might be either sitting like this, or if they are lying down on bed, their posture is on their back. This is the most common and favorite posture of the patients who feel breathlessness. That is on their back. This is the posture which, this means heart is at the top, lung is, after that the capacity of my lung is 80% lesser, so it is no surprise that I may feel breathlessness, right, if already my lung is in a compromised situation. Now what we do, very very simple and interesting, we understand the power of gravity. So being an engineering graduate and post-graduation in diabetes and little bit knowledge of how the kidney and heart works, as I told you, I got honorary doctorate into diabetes and chronic kidney disease, so I mix both of them. We have to understand, when I am standing, the gravitational force is pulling my blood towards the bottom, but the heart is trying to pull it towards the top. So there is a balance between the force of heart and the force of gravity. This balance is keeping us alive. But if the balance fails, if the gravity starts winning, then breathlessness, kidney failure, heart failure, it comes. The only thing is if the gravity wins. So those patients who are having compromised breathing, those patients with low SpO2, right, oxygen intake, so for them the heart is not able to pull the blood the way it should be. So now we use the power of gravity in favor of the patient. How I do it? You look at me. So my posture is, I think if you are not able to see me, so now when I make the patient sit like this, this is the posture, and if you sit like this right now, you will experience that you are able to breathe better, right? Immediately your breathing ability will increase. And if you have an oximeter and put it here, within 15 minutes you will see the oxygen SpO2 will keep on increasing. In addition to this, we use a small tool, a fan, you see handheld fan, battery operated, and about 6 inches from here we place it, we ask the patient to hold it or somebody holds, and this is the posture and this. When this is done, we have seen consistently the SpO2, if it is 64, it goes to 84 within 15 minutes to 30 minutes. It is not my discovery, this is already there in medical literature. I wrote a book on this, and the name of the book is called Postural Medicine. This is the book called Postural Medicine. Later on you can see the book, or if you want to read the book, next please. There is the medical reference that how the posture, for example, if I am standing and if I feel breathless, so the moment I lean like this, my breathlessness will immediately be cured, right? If I stand like this, right, this is the worst posture for the breathlessness situation. This is the better posture. So how your posture can become a medicine, that is what we have been using, we had used in our COVID center. We don't call it a COVID center, we call it a flu center, right? So this posture, it increased the capacity of the lung, and as a result, within few minutes, the patient get relief. Right? This is called throne ventilation. You may be knowing already, and if you want to know detail about this, that in different posture can help a particular organ to work better, then you can read my book bishrup.com/ebook. You can download free this book. Now comes the interesting thing. We have learned through the COVID experience that it is very, very easy to support the lung in case of the lung failure, in case of the SpO2 dipping constantly. Now the search was, can the power of gravity be used to reactivate the kidney in the same way as we did for the lung? So there I discovered a method, the method which I am going to show now, that is for chronic kidney disease patient, the dialysis dependent patient. I am talking about the patients who had been on dialysis, who go for dialysis twice a week or thrice a week. And the method which we devised, the method is what is there in front of your screen, gravitational resistance and diet system, GRAD, GRAD system. So this is a GRAD system, this is my innovation. That is, here the diet I already told you, DIP diet, right, which is clinically proven 3 times, including once in Malaysia also. And here, very interesting, you can see head down tilt. Let me talk about it. For that, I'll show you through the tool. Now, the video operator. Okay, let's see. Now, you see, this is the head down tilt. Let's say this is the normal bed, my video. This is the normal bed on which we lie down, right? 180 degree. And let's say this is the patient, video. This is the patient. So what we do in our hospital, Dr. Narjis has seen it already, to our patients, we tilt the bed 10 degree. We tilt the bed at the angle of 10 degree, and for that we use this inclinometer. No. My video. You project the camera here. You project the camera here, on me. You project the camera on me. Make it live. Make me live. So here, through inclinometer, later on you can have a closer look. Here we know it is at 0 degree incline. Now what I do, I have to incline it by 10 degree. So I place these 2 books. And now when I check it, it is almost 10 degree inclined. 10 degree inclined, that means it is equivalent to what you see on the screen right now. So and the legs are towards the side which is higher. When we put the patient in this posture for 2 hours, the urine output increases within the first 2 hours itself. So we have seen consistently the patients, chronic kidney disease patient with a nil urine output, we keep a record of the urine and we see first day about 100 ml urine output within the first 2 hours the moment the patient are in this posture. But we recommend that every day they have to be on this posture for 2 hours, that is in empty stomach. So originally you can try at home, it seems to be very easy, but you will see, most of us will not be able to do more than 30 minutes. The first day, you will not be able to sustain lying down in this posture more than 30 minutes. Why? Because the power of gravity, it is pulling the blood from the, it is pulling the blood, it is pulling the blood from the legs towards the kidney, right, and towards the upper part near the heart. And once this is done, the kidney activates, the urine output increases, and these, whatever I am saying, is already there in the medical literature. If you want to know more about it, you can read this book for the references. So my protocol is very simple: DIP diet plus head down tilt. So whenever a chronic kidney disease patient calls us, so we ask them what are the classic symptoms. The classic symptom of chronic kidney disease is uncontrolled blood pressure, number one. Number two, urine output very less or nil. Very less means anything less than 400 ml in the 24 hours. Number two. Number three, most important, swelling in the limbs. So now we say the moment you do this and be on the diet, DIP diet, within the first 24 hours, our expectation is urine output should increase by about 100 ml. His swelling should vanish little bit, right? Clearly vanished, can be compared through picture, photographs. And once they keep on doing it for several days, and a time comes when his urine output increases, say about half a liter per day, which we consider a substantial improvement. So for most of the patient, many of the patients who are recently diagnosed or who are recently recommended for dialysis, if a patient has not already gone for dialysis, just the doctor said, now it is the time that you have to consider dialysis. If the patient comes at that position, then what I just said, these two protocols are enough to recover. How we know the patient is recovering? That is, we consider the symptom, whether the symptom are vanishing or not. If the symptom are vanishing, this means the patient are recovering. Okay. Now, come back to the screen. Light switch off, come back to the screen. So, but there now consider the third case, the most difficult case, the patients who are already in dialysis. The patient who had been going to dialysis about twice a week and they've been going for last 1 year, 1.5 years, sometimes 2 years, 3 years, right? They had been on dialysis, urine output is always nil for those patients. So, for those patients, using the law of gravity, what we call as you see in the top, hot water immersion, the most powerful tool. Hot water immersion, this means we put the patient in a water tub and the temperature of the water is 40 degrees Celsius, and I'll show you my hospital. You see, these are all chronic kidney disease patients who had been going to dialysis almost twice or thrice a week. Instead of that, we ask them to be on a hot water. Here you see the temperature of the water is 40 degrees Celsius and the water level is till neck, as you can see, and they have to lie down like this posture for 2 hours. So there are 3 factors, there are 3 parameters. One is the depth is till the neck. Second is maintaining of the temperature 40 degrees Celsius. And third is total number of time in the tub is about 2 hours. So now again it seems to be very simple for you that people are just idly sitting in the bathtub, but if you try it yourself while you are healthy, I am healthy, again you will see you will not be able to sustain more than 30 minutes, 40 minutes in this posture. Why? Because you will start feeling suffocating. Why? Because the law of gravity is working against you. Although you are stationary, but your heartbeat will increase, your pulse will increase, your BP will increase, and a time will come when you will be as tired as you would have been had you been doing a gymming or had you been doing some running kind of activity. So you can compare it with this. But interestingly, the chronic kidney disease patients, their body chemistry is different from healthy patients. I have seen consistently again and again the chronic kidney disease classic patients, they are able to sit reasonably well for longer period in comparison to the healthy person. For example, let's say there are two bathtubs, in one healthy person like me sitting and other dialysis patient sitting, chances are that I will not be able to sustain for long period, but he will be able to sit for longer period, right? Because in his body it is the water which is already deposited. Here the principle is very simple. We are using skin as third kidney. With the pressure of the water, additional pressure of the water in addition to the atmospheric pressure and the heat of 40 degree, the skin converts into the third kidney. An interesting thing which you can do at home, and that is in the first day itself, in the first 1 hour, forget about 2 hours, you can expect 500 grams to 1 kg reduction in weight. And then when the patient comes out and we see the 500 gram weight loss, then we realize it is that swelling which was there before he went into the bathtub, that swelling got vanished to a great extent. And one second interesting thing is, especially those patients whose blood pressure remains uncontrollable in spite of taking medication, with this is a very, very effective to control the blood pressure, and that effectiveness you can see on the first day, in the first hour itself. So what we do in our hospital, the protocol is very clear. Before the patient goes inside the bathtub, we take the blood pressure, we take the weight, and we take the pulse, and after he comes out of it, again we take all of them, including the swelling, how much it is looking, right? And then we have seen that for most of the patients, always the blood pressure keeps on reducing, swelling reduces, and also energy level increases. So all those things, weight reduces, all those things we keep a record and we see the similar result. This means now they can skip dialysis. So let's say a patient come to us and normally he goes for 2 dialysis per week, and the moment they start with all the therapy like this, within 1 week they used to go for 2 dialysis, now within 10 days they go for 1 dialysis, and then 15 days, and within 3 months for many of them they get freedom from dialysis. But yes, instead of dialysis they have to do this at home. But the good thing about this is they need not to do for rest of their life, only 3 months, 4 months, sometimes 6 months, but then slowly they can taper off all of them. But DIP diet they still continue, but now they are free from dialysis and the medication and all the symptoms. Observational study was done by Dayanand Ayurvedic College and Sridhar University in India on our patient in our hospital, and they found that 75% of the patients could be free from dialysis, total freedom from dialysis. So that is their conclusion. If you want to read that the observation study, so this is the poor people. What they do what you see at their home, right? They use it, they're inside the hot water, and you see they were kidney patient. They were having dialysis twice a week, thrice a week, but now instead of that, instead of going to hospital, they decided to be on the bathtub, or this is a refrigerator, and the door is taken away, right? And refrigerator they bought from a second-hand market, right? And even then that helped him. Now you see this patient, he made a wall in his bathroom, already there is a geyser, and he maintained a temperature. He is an engineer in the Maharashtra, and he made a portable bathtub which can be carried anywhere, right, with the wheels, right? So these are all innovation done in India by our chronic kidney disease patient. Now you see, this is another innovation. He kept a television also in his bathroom, so that those 2 hours he can entertain himself. Now you see, this patient, he didn't have place inside his home to make a bathtub, so he made a cemented bathtub outside, and now this patient, Syntex tank, the water tank, he cut into 2 pieces and he used that as a bathtub. But these few of the people, they bought the conventional bathtub from the Amazon, etc., and they tried to use it. The problem with these bathtub is the total effect will come only if you are dipped under the water till neck. but the depth is less, as you can see. This means either they have to be in the bathtub for longer duration or the benefit will not be great. Here again the water tank is divided into two, and this fellow, for his wife who was a chronic kidney disease patient, made a bathtub, and this man he dig on the earth and innovated a way to cost effectively create a bathtub. This is a poor man from Rajasthan, and he also used very less money to make a bathtub at home. This young man, as you can see in the water, 17 years old only, twice a week dialysis, but no more now. Now he is dialysis free because he had been doing this hot water immersion only at home. This means no money is also required, only technique that can be done at the convenience of the home. And if you want to know more about all this, you can read in this book how the people in India, they started innovating hot water immersion, GRAT system, and now this observation study I am talking about, one very respected journal called International Journal of Healthcare. This is by the Taylor and Francis group, which is one of the oldest journal group, and they have accepted for the publication of our observation study in their journal. So this is the reference, why I am showing this, so that you have little bit faith on me that it is not just on air I am talking about. We are literally doing it in our hospital, and maybe I'll invite it not only in India but here also. Last time I came here, that was the month of June. No, it was 23rd June to 25th June, 3 days. I was here for a camp, right? And my team here, I will introduce my team, Grace and Jessica, please come here. So this same system, what we do in India in our hospital, Dr. Narjeet is having my Lifeline Center. I visited last time, and he learned all the things. He's seen the patients benefit. Dr. Fernando sitting right there, he was also there last month. He saw all the patients and how they could miraculously heal, and some of the patients were even diabetes type 1 patients. And the similar thing we did in Kuala Lumpur here only on 23rd to 25th June. Here I am presenting only one of the patient's testimonial, just to make you understand. It is not that this works only on Indian patient, it can work even on Malaysian patients, right? So here you see, I am talking about one patient. On 6th June, his parameter was 8.57 was his creatinine, his urea was 150, and swelling in leg, weakness and laziness. But after he started all this, whatever I just told, you see his creatinine reduced to 5.79, his urea reduced to 42, and no swelling, freshness and energetic, and this too within 20 or 30 days of this, only within 1 month. And interesting thing is, he did not do 100%, he did 50%. Why I am saying 50%? For that I am going to show his video. Let's see what he says. These are his pathology report before and after, which I am sure that not visible from that, ignore it, but see his point of view, what he says. This video, audio भी है इसमें, including audio. एक बार फिर से ये है, अब आ गया. The video is not coming. So as you can see, if you can see from there, his body is immersed in the water only till chest, right? Not up to the neck. So I think there is some problem in this. Okay. Oh yeah.
2020. Hi everybody, my name is Dr. I've been learning this hot water injection OH since 23rd of June 2020. Until now, I've been trying to do this HWI single or couple of days times daily, especially when I was not going for dialysis. I'm having hemodialysis 3 times a week. And now I found out the symptom. My legs very heavy, no more sweat. And my body is deep sweat. And I feel fresh all day. There's no kidney failure patient is exhausted all day long.
So this is the patient. He stays in Kuala Lumpur only, right? His dialysis was from Sabang Jaya Medical Center, Selangor, Malaysia. You may be aware of this center. So these all things can be verified, and I hope that it can be duplicated here in Malaysia. And for that, Dr. Narjeet right here, he is taking initiative to start it in his own hospital, that is My Life Center Hospital, which is in Kuala Lumpur. And till the time Dr. Narjeet is able to start his hospital equipped with hot water immersion and GRAD system, till that time, to benefit the patient, my team in Kuala Lumpur, Jessica and Grace, you come here. And this is the next residential tour, that is on 23rd to 25th of November. I'll be here in this hotel. Interestingly, hotel is in every room there is a bathtub, right? And the manager of the hotel, he learned that how to keep the temperature under control 40 degree for 2 hours. Right, but when the patient starts with first day, we don't recommend 2 hours, we just say 30 minutes to 45 minutes. And in the last camp also, we have seen the improvement even when the patient did less than recommended time. So this is the next our camp in Malaysia. So I invite all of you to witness the camp, not as a patient, because here there is no chronic kidney disease patient. But yes, this will give you a hope, this will give you the confidence that yes, very simple thing can also be effective, right? So it is not important that the thing is simple or complicated. Important is whether it is giving a result or not. So the results are there, and those who are curious to know and learn, this brochure is there. This can be taken from my team or from me, and I hope that one day, with your support, with your help together, we can make this world a better place to live, and we can help the patient free from dialysis. Thank you. Thank you. Thank you. So I am around, and since it is the last lecture, after that Dr. Narjeet, Dr. Fernando right there, Dr. Aziz right there, or me, or Silverani there, Grace, Jessica, we can have talk, anything you want to ask, I am there outside, right? So all the best. I welcome all of you. I propose with Dr. Narjeet that the next muffin meeting next year, I propose, if you give an opportunity, you can host it in our hospital in New Delhi. And our hospital, the biggest one, is 1000 bed, is this much auditorium is there, residential, everything is there. So it will be our honor if Dr. Paramjit Kaur, if you are listening, it will be my honor, our honor, to host the muffin along with Dr. Narjeet in India, in New Delhi, in our hospital. If you see our hospital, it doesn't look like hospital, it looks like a resort, right? Because we want the people to be comfortable, and while being in a comfort, they should be cured. Thank you friends, all the best. Thank you.
अगर आप लाइफ सेविंग वीडियोस, हेल्थ टिप्स के रेगुलर अपडेट्स चाहते हैं, हमसे व्हाट्सएप से जुड़ना चाहते हैं, तो स्क्रीन पे दिए हुए नंबर पर व्हाट्सएप कीजिए अपना नाम।